The Chatham-Kent Ontario Health Team, also known as CKOHT, is a partnership committed to co-designing a local healthcare system with improved access to care that is easier to navigate for everyone. CKOHT has been participating in an exciting accreditation called Best Practice Spotlight Organization, also known as BPSO. Let me take a couple of minutes to tell you more about it. CKOHT currently has over 100 partners who participate on one or more of the 3 advisory councils, 7 working groups, or the many action teams. BPSO is one of our 7 working groups working in partnership with one another. Our vision is achieving the best health and well-being together. The BPSO working group began planning and meeting together in September 2021 and has had participation from many healthcare organizations across Chatham-Kent. These dedicated champions have met during the COVID-19 pandemic, showcasing their commitment and dedication to making positive changes in our local healthcare organizations. The path to BPSO designation is a long process, but one that is worthwhile to partake in, one in which we learn from one another, help to improve staff satisfaction, implement new processes and practices to make better healthcare workers, make improvements to our healthcare organization, and ultimately benefits our patients, clients, and residents. BPSO is an internationally renowned program brought to us by the Registered Nurses Association of Ontario, with partnerships and organizations participating all over the world. The work that we do through BPSO is guided by the quadruple aim, meaning that in everything we do, we seek to improve the patient and caregiver experience, improve the health of populations overall, reduce the cost of healthcare, and improve the work life of providers and healthcare workers. By participating in BPSO, for healthcare workers, this means that this will energize teams and build frontline ownership to better respond to healthcare system transformation and improve outcomes for patients through increasing clinical excellence and expertise. We are creating those cultures that promote continuity of care to better assist patients when transitioning from one organization to another. The goal of all of this work is to benefit patients through higher patient satisfaction rates of the care that they receive, because there is more understanding of providing care from a patient's perspective and an overall better patient experience. A lot of work has gone into improving transitions of care for patients across organizations to transfer care in the best way possible for patients. We have established our infrastructure, such as meetings, signed contracts with 13 participating healthcare organizations in Chatham-Kent, and have identified hundreds of change champions across all of these organizations to act as ambassadors to make these improvements within their own workplaces with their staff and colleagues. It will take us 4 years total to achieve the BPSO designation through the implementation of 4 best practice guidelines. We are currently in the middle of our journey. We have implemented Year 1 Best Practice Guideline, which is person and family-centered care. It is a philosophy of care that ensures we work together as a true partnership with our clients, patients, residents, and their families in the planning, shared decision-making, monitoring, and evaluating care to make sure it meets their needs. We are currently working on Year 2 Best Practice Guideline, which is transitions in care and services, to focus on when a person's information and care needs are being transferred between health and social service providers, teams, and settings. This requires thoughtful attention, compassion, and a strong emphasis on safety and barriers to care. So far, we're on track and meeting our targets of success. We will continue to work together and identify areas to reach as many people as possible on our journey to improve local healthcare. Our BPSO journey continues towards designation to be achieved in 2025. If you have any questions or comments, please contact us at info@ckOHT.ca.